of course, the Houston Health Department are going to be embarking on a trial where we are going to be in advance randomly selecting addresses across the city, and we'll be visiting those residences and asking people to participate in this trial. If your home should be selected, a team consisting of a Houston Health Department employee wearing a Better Together T-shirt, along with a paramedic from the Houston Fire Department, will arrive and explain to you that you are one of the ones, your home is one of the ones that was randomly selected to participate in the program. And if that should occur, what you can expect is there will be a simple questionnaire to be filled out, and we would ask that that be filled out for every member of the household. And it's not difficult, and it's pretty straightforward questions. And of course, there will be no questions related to things like social security number, bank accounts, none of those types of things. But we will ask about if you've had signs and symptoms of COVID, if you've been exposed to anyone that you know that has had COVID, things along those lines, medical COVID-related questions. We will then ask if we can obtain a blood sample from each member of the household, which will be tested for antibodies. And that's important to us to get an idea is across the community how many folks have been infected and to what degree of antibody response they have. Because as we move forward, we need to know this information to get an idea of what the virus is doing in our community so we can get ahead of it and control it. So this is what we're going to be asking. One is to fill out the questionnaire, and number two is for a blood sample. We will come back again in January, as the mayor said, and do this again. Again, there will be a random selection of addresses across the community. But in addition, folks who test positive the first time, we are going to ask you if you will participate with us again the second time, because we want to be able to see and compare what your antibodies are doing as time goes on. As I said, this is voluntary.